Toowoomba leather worker Andrew Reeson spends most of his week in this workshop.
Leatherwork, it's a good job, but doesn't pay very well being a full-time creative, particularly at the moment with the cost of living.
A few years ago, Andrew and his young family qualified for a low-income healthcare card and joined the public dental waitlist for a general checkup.
Essentially, every year we have to prove that we're poor enough to deserve it, which is not a fun process.
It's not the first time Andrew found himself on a public wait list for his teeth.
When I was about 13, my parents took me to a dentist to see about getting braces. We looked into the state system and I was put on the wait list, and 5 years later I was called up to say, there's a spot for you, great, but you need to be under 18, and I had just clicked over that point. And so after 5 years of waiting, it was irrelevant in the end.
As an adult, Andrew got to see a dentist after 2 years on a wait list.
They found that there were multiple cavities, as well as my bottom wisdom teeth are pointing forward and they'll need to be surgically removed because they're buried in the gum. Top wisdom teeth are growing sideways, and I also have a fifth wisdom teeth somewhere up near my ear.
Andrew says he was told that the public system can't cover for his wisdom teeth extractions, so he's gone without for now.
It's a ticking time bomb. At some point, we're just going to have to deal with it.
Patients requiring urgent dental care are prioritised, but around the country, wait lists are ballooning. The wait for general care is between 1 to 2 years in Victoria, New South Wales and Queensland. The longest wait times are in Tasmania and the Northern Territory, where some patients can wait for up to 5 years. In WA and South Australia, wait times are more manageable, with an average of a 5 to 7 months wait.
I think when we're looking at the public system, we don't have the workforce, we don't have the funding to be able to manage the entire load. So I think it's definitely on a knife edge.
Vice President of the Australian Dental Association, Dr. Angie Nielsen, is a public dentist in New South Wales.
Most dental diseases are preventable, essentially, and if we're able to get on top of them every 6 months, it means we can get to them before they become more complex and before they end up having to be a presentation to the ED department.
Following the recommendation of a Senate inquiry into access to dental care last year, the federal government signalled its commitment to universal access.
I know from my own community that dental health has a direct link to health more broadly in the same way that mental health does. And any good government from budget to budget will try and work out if they can do more.
But earlier this week, Health Minister Mark Butler told the ABC there are no short-term plans to include dental. Greens Senator Jordan Steele-John, whose party took universal dental access to the election, says that's not good enough.
We need to work together across the Parliament to actually get some action here. The government can't continue to brush off this much-needed reform.
While Labor has a clear majority in the lower house of Parliament, the Greens will hold the balance of power in the Senate.
So there's many opportunities for us to bring these issues right to the front and ensure that they are centred as we should be working to centre the experiences of Australians living right now with untreated dental care issues.
The Greens' proposal could cost the health budget up to $8 billion a year. While Dr. Angie Nielsen says better access to dental care is needed, she's worried that folding dentistry into Medicare will cause more problems.
When you're looking at doing it a free-for-all, then it's just not going to work. It's going to be massively obtrusive to the taxpayer's pocket, but also it's really challenging work, and it's getting clinicians to agree to it will be very difficult.
She says the main barrier to access to dental care is extreme shortages of dentists willing to work in the public system.
If we cannot attract clinicians to public oral health, then I don't know what the future will look like. There needs to be other ways to look at how we're going to manage our most vulnerable Australians for their dental care.
She says selective concessions for vulnerable populations may be more sustainable.
I think it's realistic if we're looking at doing it in targeted ways, something like the Senior Dental Benefits Scheme, expansion of what already exists, like the Child Dental Benefits Scheme.
What do you want to have for lunch?
A YouGov poll conducted late last year reported that 80% of Australians want to add dental to Medicare.
It'd be huge. For us personally, we've got 3 kids now, and it would be such a relief knowing that they're not going to have to go through the same stress and pain that we have.